Thank you, Cindy, for your invitation and also for organizing this panel. I think that we had a very interesting discussion for the first discussion between our two panelists before. And one of the things that we understood is that we are in a complex environment. And the fact that we want to implement artificial intelligence tools in this complex environment will require a lot of efforts. One of them will be to educate the people who are in the healthcare providers today and for tomorrow, but also to see how we can use in a very appropriate, ethical, and way to have all the benefits of artificial intelligence tools. Just before, when we discussed about the implementation and the speed of implementing artificial intelligence in healthcare, there was one point that we didn't mention, which is the shortage in healthcare providers today, everywhere in the world. And AI tools could be something that will help to reduce this shortage. So maybe this is something that we can also discuss in terms of risk benefits with our three panelists, who are extremely famous, each of them. And I'm very happy and also proud to moderate this session with them. So, as you have understood, we are from North, and I'm a French-speaking person. So I had some help to have the question, and Cindy helped me a lot, and I wanted to thank her for that. So if we look at the way we will split this panel discussion, we will first address the question at three levels, which is at the level of the frontline caregivers, the individuals. The second, which is the team managers, clinical, but also we can do some thought about research and education too, because it's a component and we are in university here. So we have to think also about education and research. And third, at the level of the leadership, the governance of the organization. So I will ask the first question, which is for Annika. As a researcher and academic who has worked collaboratively with others, what do you think are the key qualities that individuals need to thrive in the fast-paced environment of AI technology?
First of all, hello? Here we are. Hi. Good question. And I think it really depends on who you are, what you do in your day-to-day life, and to which degree you're actually interested in artificial intelligence. I know people who work in a clinical setting and they love it. They want to do all the extra education. They want to know everything from how a neural network works, what kind of decision probabilities you have, to what are the ethical boundaries. And then there are people who don't really care, basically. And that's okay, that's fine. And so when you want to understand artificial intelligence in general and want to develop educational content for it, you have to be somewhat mindful of that. Because I think one bias that we have in my field is that we think everybody is as excited as we are. And I say this as a computer scientist, right? I'm not a healthcare professional, I'm not a medical professional, and all we do is talk about artificial intelligence, how it works, and what the possible risks are. And so the one thing I would encourage for any kind of healthcare professional, whether you are frontline, a nurse working in triage, whether you are a physician, whether you are in leadership or work in the cybersecurity system in your hospital, is be open-minded, because that is the first point when you start interacting with the system, an AI system in this instance, that will make it or break it. Because if you ignore the fact that it's there, that it's coming, we can't argue it away. Whether I want it to be there or not doesn't matter. Whether the whole AI community wants it to be there doesn't matter, but it's going to come. And so being open-minded and think critically of how the system works is, I think, the most important quality that you can have, regardless of whether you know maths or coding or any of those things. Quite frankly, you don't really have to know it for some of this stuff.
Just, Annika, I wanted to ask you another question for that. We are speaking about technologies that are evolving very rapidly. In 2017, we implemented in Montreal in our organization deep learning tools and machine learning tools, and it worked very well. But now with generative and multimodal AI, it's different. People start to be a little bit more scared about losing their job, kind of thing. So how do you think the individuals have to do to adapt themselves to the speed and these evolving technologies that are not the same from one week to another week, but exaggerate just a little bit?
Well, the reality is it's not going to slow down, and we have to get comfortable with being uncomfortable. That's the reality of it. Now, keeping up with the technical component is incredibly hard, even if you are in this field and you are highly specialized. So what I would like to advocate for is actually conceptual understanding, right? The model ChatGPT 2021, the release, yes, it has changed in its capabilities, but the fundamental ideas around it haven't yet. And that applies to a number of different algorithms, right? And how they work, what the ethical risks and boundaries are, and what it means to deploy them in a real world setting. And so I know we like to use terms like super intelligence and artificial general intelligence and to scare people off. But the reality is that we're not there yet. We don't know when we are going to be there. I could look into my crystal ball and make a great prediction, but God knows if I'm right or wrong, right? That's how scientific advancements work. And so the idea is really, it'll happen one way or another, and we have to be comfortable with being uncomfortable, but learn and understand the concepts behind it. Because whether it's a super intelligence or whether it is a neural network from 2017, some of the ethical risks and consequences remain the same. The scale changed.
Thank you. So the question for Kim now, with your extensive experience in managing people, how has AI changed the demands on your current staff and the staff you hope to hire?
So, good morning, everyone. Let me just give you a little bit of context for who we are at PAN. PAN stands for the Patient Access Network Foundation. We are in our 21st year. Our mission is really to drive access, affordability, and equitable healthcare, and make sure that it is accessible to everyone, but particularly to those who've been forgotten, to those vulnerable populations. And so my role, in fact, was created 2 years ago to do just that. So at PAN, we are, I would say, slow adopters. We are using AI where it makes sense, where it's a smart move. We have a couple of areas where we're moving out using AI in our operations, in our marketing and communications work, and also in HR. But let me be very clear. We are using it to assist and augment, in no way to replace. Because when I started, I said, our mission is about reaching those vulnerable populations. Our brand is built on building trust. We've been 21 years cultivating relationships with people, and more importantly, with patients. Our workforce is made up of about 55% of people who are patient-facing. We have a call center, and that call center is responsible for trying to enroll people in our disease funds. We bridge the gap for those who are underinsured, primarily Medicare recipients, but we try to bridge the gap to be able to help with their out-of-pocket costs. So when they're coming to us because they have financial needs that need to be met. And so part of our work is to be able to listen and hear and respond in real time to real problems. And so there is no tool that is going to be able to do that effectively. And to be able to build that trust with the patient, particularly those who have been distrusting and mistrusting of a system that has not treated them equitably. So our people have to come with those inherent skill sets of being able to actively listen, hear, and respond. But AI can help them because one of the things that the people on the front lines are concerned with is average handle time. And so we're looking at ways to increase efficiency by using AI to help with things like note-taking, call summarization. That allows our people who are talking directly to the patients to be able to be actively engaged and helping them find solutions. With our marketing and our communications team, we're using it in terms of copy editing. It really does make it much more efficient for them to do that. The creative hat that they wear still has to be there. We also know that for our HR teams, we try to use AI as a way, again, to help and upskill a little bit with some of those more administrative tasks, helping them to understand with how they could use it with creating job descriptions. But what we're learning and what we found was that the error rate on using AI to help in that space, the error rate was much higher. And so the time savings that we thought we were going to get, we didn't get it. And so we still had to have someone come back and make those adjustments. So we are sort of in a wait and see period to see how we can continue to use AI for those more administrative or repeatable tasks, but we are not ready at this time to move towards requiring that anyone come with those skills. We are prepared to train them how to use AI, but the skills that are critically important to our mission and core to us are those people skills.
Thank you. You can see how Kim is passionate. And but maybe after we will continue the discussion about what kind of new data AI can add to the data you have today for the decision-making process that you are describing. So for instance, the environmental data, exposoming, as we say. And this is maybe something that we can discuss after. But I was really, really thrilled by your response.
Thank you.
The first question for Alicia, okay. With your experience in privacy compliance and governance, what worries you about the rapid implementation of AI with today's workforce?
So thank you, Fabrice. I sit in this unusual world of having a long history in risk areas, including privacy compliance, ARM, legal, and then now I'm in innovation. And so I sit here in this space of seeing sort of both worlds, where I thought I was a progressive leader in risk before. Now I'm on the business side, like wasn't progressive as I thought. However, that's good to know. I think what it does is create a lot of empathy for what people are worried about on the risk side and helping the business people see that. The pace of what we see with AI, I mean, I think that stating the obvious, we already know it, and my fellow panelists said the same thing. It's going so fast, and people are feeling left behind if they're not leading in the space itself, and your risk is getting greater, right? And so that risk of the unknown is really hard for us to figure out. We talk a lot about, risk of operational risk and liability risk, and Matt talked a little bit about that. And we are very worried about the liability of it. What is this black box? As we like to say, I can't see how you're thinking. I can't see how you came up with the answer. Like, what are the risks and how am I going to defend against them? But then on the flip side, we have the risk of lost opportunity. Like, what is the risk if we don't take advantage of AI? How can it help us do that? A lot of our risk that we have is we don't document it. Like if you didn't write it down, it didn't happen. How many times have you heard that, right? That's something that all lawyers and risk people want to see is what was your thinking for it? Can AI help you? On the flip side, on the compliance side, there's a real risk that you're going to be coding it wrong and you're going to be upcoding it. And now I'm going to have fraud charges against me because my doctor signed off on something that the AI generated that actually wasn't validated. So I think the biggest thing in terms of the pacing is getting people to stop for a minute and think. At the end of the day, it's your name on that order. It's your name on that bill. It's your name to that patient. You're the person who's being held accountable for. It's still a person. Do you trust what you got? And do you understand how it got to the answer? And can you defend it? Do you understand it? I think one of the biggest risks we face is when people think that AI is the solution, and it's not a solution. It is a tool. I still need people to think critically. I still need your judgment. I still need your training. I still need you to think about, why did you choose to go that way? In my experience, federal agents will generally it will land with them if you say, okay, I understand why you and I disagree, but this is how I got to my answer, and this is why. And usually an agent will say, okay, I still think we're going to go this way, but at least I see how you got that way, and we'll get there together. If we don't justify that, and we're able to understand how we got to that answer, and we just say AI did all of it, that's not going to be really a viable defense. And so I think really part of what concerns me is, can we remember to think? Like, we still have to do the thinking of it, right? It's a tool, not a solution. I think if we keep AI in that framework, it could be incredibly powerful because it really could give us more time to think, right? Like right now, I think part of in healthcare, our biggest challenge is that we're so busy documenting and doing all the things that regulations require us to do. They can't actually practice medicine. They can't actually spend time with the patient. If AI can help us with that and create more bandwidth for it, we could actually deliver better outcomes and better care and actually lower our risk. But there has to be this understanding of what that potential is and how can we make sure we can articulate why we came to the conclusion that we came to.
Thank you. I have the question for the three of you. Research indicates that transparency, trust, and confidence, we just talked about that, are three critical areas in developing talent. How do we as leaders move faster when technology is presenting novel challenges regarding trust, safety, and understanding? Who wants to start?
I'll go. Okay. How can we move faster for that? I think, again, bringing everybody along. I know this panel, I'm serving as the risk voice. I think great ideas will die when you get to the risk division because they don't understand and they're going to stop it. And I'm sure some of you have experienced that. It's not because they don't want to help you. It's because they're scared and they don't understand what it is. And their entire job is, you don't call people in the risk division unless things are going poorly. Nobody ever calls me as the chief privacy officer until something was going really, really wrong, right? So the whole job is to defend and to make sure that we can avoid disasters from happening. Bring those people along at the beginning so they're on the journey. So to Annika's point, they understand generally what's going on, but they also feel like they have a stakeholder in it and they're early on to help advise instead of like deal with all of the disaster or doom and gloom at the end. If you can put them at the front, they'll help you shape it, navigate around the landmines, and it will help you go faster. A lot of times people look at risk people as being obstacles and slowing it down. Help them use them as a compass and put them in earlier, go slow at the beginning. You'll be able to go fast at the end because they'll be there and they'll be on board. And then they will become advocates for you and evangelists for you. That's how you'll go faster through the process and that gauntlet that we all have to run in an organization.
And just to add on to that, which I think is a really important point, we can't continue working in silos, right? Research, education, and application have to be deeply connected, more connected than they are right now. And it also includes community partnerships, having patient voices and experience heard throughout the development of these technologies. And I think there is currently a really big divide, right? We have this idea of AI and we have this group of people. I belong to called Responsible AI, and we have this group of people who just run ahead and sell something and say, oh, this is fantastic, this is great. But when you go down to the nitty-gritty, who did they consult? Were the domain experts involved? Did they actually talk to a patient feedback engagement group, a research community studio, anything along those lines? 9 times out of 10, they haven't done that. And I think this is really, really important as we think about, being AI ready, quote unquote. I don't think we'll ever be ready, really, unless we start working together. And that means mingling intentionally with people who are not in your discipline, who are not part of your expertise, and having that, somewhat humble attitude of, I don't know what I don't know, and say, explain it to me, and have that open dialogue. So
Can I just
let's go.
That's so important. I think what Annika is saying in that make sure there are different voices that don't think the same as you, because if you can't defend it to each other, or an accusation or defense question, either, but if we can't explain it to each other, we won't be able to explain to the public, to the media, to whoever's going to come and ask. So I think having that really multidisciplinary group from the outset and make sure you're pressure testing as well.
Yeah, I didn't have something different to offer, but I'm so glad I sat between the two of you but you really, from a risk perspective, the risk management at an enterprise level becomes critical, that you're looking at risk not in isolation, but that you really are bringing everyone together and you're having a healthy conversation, and you're also building a mitigation plan as you're going. So that you're using an opportunity for discovery to understand what are all the roadblocks, what are all the barriers, what are all the potential implications of really launching any kind of tool. And on the other side, one of the things that we know is that it takes a long time to build trust, and it can take seconds to erode it. And so the reputational risk becomes really, really high, particularly in healthcare. And so when we go about putting together or launching any initiative, it is about building community. It is about what we like to say, co-designing, and then having community co-sign on a particular initiative. And so engaging and finding out what are those perspectives. Gaining and reality testing, gaining diversity of thought and perspective is really critical. And so I go back to the point of, while the technology is rapidly, I think it was Dr. Patel who said it's changing where someone said every 72 days, there's some kind of update. I'm a baby boomer. That's way too fast for me. That is not happening. We're not trying to figure that out that quickly, but as an organization that's in its infancy phase of adoption, it does become critically important that within those 72 days, we are continually assessing, evaluating, and trying to figure out ways to incorporate or to integrate, AI into our operational functions.
And just last thought on this. I think a really important point is that we create a shared language. When the question was initially asked, I, as a computer scientist, think about transparency and explainability, very different to everybody else in this room. I look at it from a technical perspective, meaning I think about the computational methods that we in, for example, my lab have to develop to understand AI. I don't think in the first instance about all the points that were just made now. And developing that shared language is really, really important to not just understanding concepts, but managing risks and developing in a meaningful way.
Thank you for these fantastic answers. And I think it's a very tough question, by the way, and we can answer in different ways. Just in terms of trust, confidence, we have more and more residents, the medical school is implementing more and more education on that, and they are using generative AI to make their own decision, which is not always the same as the senior physician have elaborated their thinking and their diagnosis. It's something that we should also consider, because sometimes it's not visible, but it's present in our organization. But let's move to the second part. I have a question, the first, and this is for Annika. Can you provide an example on how current talent can be managed to embrace, understand, and deploy AI when new models are emerging at a pace difficult to maintain?
I think to some degree we have already answered that question, where we need to continue taking that fear and anxiety out of it, because there is a lot of fear mongering, right? Like there is a news headline every other day saying AI is taking your job, you will be absolutely irrelevant in your role, and the reality it's not. It's just not. And I think when we think about developing talent, It is creating that mindset of awareness and understanding what the limitations are. And let's be honest, that also depends on what kind of talent, right? Someone in cybersecurity should be very concerned about AI and what it could do to your hospital system if, for example, another agent, AI agent, is used to attack the system to get patient data, or simply make your whole system calm down so that your medical professionals cannot access EHR records. On the flip side, someone who is triaging, right? They do not have to be as concerned in that sense about those vulnerabilities. So being clear on roles, responsibilities, and what it actually means to use AI is the best way you can take that fear out of it, because knowing to some degree reduces that anxiety.
Maybe I want to add another question to this one. Do you think that in the multidisciplinary team today, we need to have some data scientists or data specialists inside the team or outside the team to explain how fast the things are changing with the new AI tools?
I think there needs to be continued education. Does that have to be a data scientist? That depends on your role. I think I work with Maine Health, for example, healthcare system in the state of Maine, and they have a Cypher research group, and they have data analysts and computational specialists there that work with the practicing physicians and their teams on developing these kind of technologies. And the knowledge exchange happens to a degree naturally. Would it be useful to have a consultant to some degree, hovering almost over a hospital system? Yeah, that'd be really useful. Is it a data scientist necessarily, or just a data scientist? I'm not sure, because there's so many different areas of AI, and data science is literally taking a data set, running an analysis, doing some predictive insights, and outputting some results. That person is unlikely to be able to speak on ethics, governance, risks, cybersecurity, and other things, because nobody is that much of a unicorn.
Thank you. I have a second question for Kim. What are the most important qualities you are looking for in finding talent able to keep up with the rapid advancement in AI?
So I go back to, I think, what I said earlier, in that we aren't looking for people who are experienced or skilled in AI. For us as an organization, health equity serves as a foundation or an underpinning of the work that we do, whether it's our financial pillar or our advocacy or the one that we just stood up last year around education. Cultural humility and cultural sensitivity are the pillar, or are the qualities that we are ultimately looking for. I mentioned that 55% of our workforce are on the front lines dealing with patients every day, and a subset of those representatives are what we call companion access navigators. In September of last year, we stood up an initiative called Opening Doors to Clinical Trials. And it's effectively a way to increase health literacy of people, again, who have largely not been a part of clinical trials. And so one of the components of that initiative was to stand up a concierge model contact center where, unlike those representatives that I mentioned are concerned about average handle time, these representatives are not. They spend an average of 25 to 30 minutes on the phone with someone who's calling to find out about clinical trials. And what we found was that in order, and we're trying to get to the barriers as to why people don't want to participate, what we found was that a lot of times the barriers are tied to non-medical drivers of health. People are struggling with basic social needs, transportation, childcare, rent, food insecurity. So you've got to have people who are skilled at being able to listen and get to the underlying root causes of why someone is unable to participate. So the skills that we look for are things like empathy, compassion, active listening, someone who really does understand the concept of intersectionality, understanding lived experience, and how socioeconomics and education and upbringing and all those things really do impact how someone shows up and how the person that we have hired is going to be able to address those problems and relate to people. And those are things. It is a combination of experience. It is also understanding that people are looking for gender affirming care. They're looking for culturally affirming care. And those are the kinds of qualities that we try to hire for.
But let's say that AI can provide you with new information about social, economic, or data that you have not recorded before. I am a physician. I will listen to what the patient will tell me, but sometimes they will not tell everything. And with AI, especially with the Internet of Things or connected object or sensors that you can have in different environments, you can, in that case, add new information that are not recorded or considered by the clinician before. So in that kind of new information, what are the qualities of the healthcare givers regarding the information coming from AI?
So I think you make a good point in that I think AI can augment the critical thinking and the problem solving that we're looking for people who have an open mindset and are willing to engage with the technology, but not be too dependent on it. They still have to think critically, because just because you get an output from using an AI tool doesn't mean that you still don't have to have a healthy skepticism, and that you are looking at that information, again, going back to bias, going back to the data sets that may not contemplate the communities of the people that we are trying to serve. You still, you
Alan?
Okay, testing. Good. So I think that, again, you can use AI to augment, with new information, but at the end of the day, you still have to be able to rely on your own judgment and decision-making to come to the best outcome for your patient.
Yeah.
Yeah, I was just going to add something to this there, because we have this, we're looking at a variety of AI products too, in terms of research studies are incredibly important to us and increasing the diversity of it for a whole variety of reasons. But there's so much data. How do we use AI to then match a patient to a potential research study, do that work in the background, and then have our primary care physician, who's already trying to run, 20, 30, 40 patients in the course of a day, have the conversation with the patient, say, hey, you have this potential diagnosis, and there's a potential research study that has it. And to your point, use AI to scrape the medical records on encounters that particular physician doesn't have time to read through, but build the model and the profile for the research viability and potential for the patient. Part of that, I think, really requires clinicians and providers and everybody to really have very much of an open mindset. Use the word openness. I totally agree with that. And really understand the opportunity to leverage AI, not delegate to it. And I think if we can leverage it to get a better outcome for the patient and really be I would keep using the term pliability, I think is really one of the core characteristics you need, I think, in all of your workforce, no matter what the job, especially in the environment we're in. But that willingness to have to bend and contort in a way that maybe would be a little bit different than what was from before. What worked before won't work, as we all know, moving forward. That doesn't mean you have to throw it all out. It just means you have to be willing to keep building and evolving. And that kind of openness to being evolutionary, I think, is really what you're looking for.
And just to add on to everything that was said, if you think about an application, for example, extracting automatically social determinants of from electronic healthcare records. We often talk about this from the perspective of just the healthcare first needing to be ready. How many computer scientists, and I don't know how many are here in the room, know the term social determinants of health and know how to develop technology as a computer scientist that is meaningful. So this education and skills conversation needs to go both ways to some degree. And I just wanted to make that point.
A very good point, by the way. That's a very good point. It is not on one way, but on multiple ways. So I will ask the second question for Alicia. Can you provide insight on how to mitigate privacy and compliance risk that employees should be aware of as they turn more and more to utilizing AI tools to either develop or augment their work?
We keep touching on it. It's not completely relying on it. I think there is no AI without data. And I think that's really obviously the backbone to it, understanding what the implications are of that data, the privacy protections on it, also the limitations of what to do with it. I do think that part of managing that risk is to do what your organization is asking you to do within the protections that it's put in place. Cyber risk is enormous. There are reasons why you have a cybersecurity department and why they do put restrictions on using the platforms that they've approved. And there are really good reasons for that. And so I think making sure that you know the why, what are the risks that you're looking at? And again, thinking beyond yourself. It isn't just what it does for, what does AI just do for me, but how does it affect us? And I think half of risk is just thinking, how does that affect all of us? And then bringing other people into the conversation and asking the why. The person who worries me the most is not the person who's always worried about messing things up, or I'm going to do something wrong, or I'm doing something illegal, or I'm doing something that's violating. That person doesn't worry me because they're thinking about it. It's the person who's completely confident they know exactly what they're doing all the time and never has a doubt. They worry the bejesus out of me because they are the people who just charge boldly and then cause all sorts of problems. And so really just ask the question and ask it. Go ask. Nobody thinks I would have to ask Annika 97 things about what she said because I think what teams really need is a communication branding person who doesn't sit as an expert at all and can explain it to the layman terms, but ask it and have some humility and wisdom to ask the question, right? The only problem I can't fix is the one I don't know about, we usually say, so ask it.
And just to add on to that, I would have to ask both of you the exact same questions.
See, it takes a village. It takes a village.
But also, and I think this is a really important point, a lot of conversation has been around using artificial intelligence and the importance of data. And yes, data is important. But the one thing that nobody has mentioned is the algorithm itself. Like algorithmic bias and fairness issues are real, they are not at the data level. And so when we talk about health equity, how to make artificial intelligence, meaningful for marginalized populations, we have to also talk about the algorithmic piece. And that is not just generative AI. I know generative AI is what everybody talks about, everybody knows about at the moment, apparently a lot. But it is only one type of artificial intelligence, and it is currently being pushed to be used in the healthcare space. All the other types of artificial intelligence we're using, actually, we're not really talking about. And they come, all of them, with very different risks and benefits. And yeah, it's a consideration. It's not just the data, it's the post-processing, it's the model itself.
I'd like to ask you a question for the three panelists. We have talked about evolving in this complex environment, which is difficult also for the data scientists to come and to discuss and interact with the clinicians. So we need to have education. Annika, you said about continuing education, which is a part of that. But we also need for that to have educators and people able to teach you in this very fast changing environment. I mean, for technology, but also for healthcare. We have imagined now to have learning health systems. The learning part will be that we will adapt and respond better and better to the needs of the population and the patient we are treating. What should be or could be the education system that we will have to use in our healthcare organization to adapt rapidly to the change in technology? I know that, for instance, in China, a little bit in India, by the way, they are using AI to teach AI. So should we move toward that? Or we are in a university here, so I really want to also think about the role of the universities in the future. So who wants to answer this question?
Okay, me again. Yes, that is going on. And I think there is a place for using artificial intelligence to distribute skills. Can it happen without domain expertise? Absolutely not. Absolutely not. That is ludicrous. And I think there are a couple of issues here, really. How many people right now are actually trained in artificial intelligence? And I'm talking mathematics. I'm talking computer science. I'm not talking about like using software engineering, for example. We know artificial intelligence right now, as we're speaking, is already replacing software engineering. In fact, they're estimating by the end of this year, a lot of the code that we're using to develop these systems is written by those systems. So let's think about that. What does the education in that space look like? There are a couple of undergrad degrees right now in artificial intelligence. One of them is at MIT. There are various names for it. The technology is incredibly fast evolving. So when we think about how can we capitalize on distributing skills in a meaningful way, yes, we probably have to some degree no other choice than use artificial intelligence for it. And that's kind of sad, right? But there's a value trade-off here. Are we going to risk missing out and letting people just run wild with it? Or are we going to be like, okay, let's look at this from a, responsible and development and ethical perspective. How can we guardrail in our systems that educate to make sure that the content and the information is grounded in clinical practice alongside of artificial intelligence? And that goes back to the first point. We can't work in silos. And the reality is, if anybody is under the impression that there's going to be an army of scientists coming to save you anytime soon if AI goes haywire, I do have to disappoint you. We have to wait until they graduate. So, yeah, that's my 2 cents.
Yeah, Annika, I agree wholeheartedly with what you said. Sort of understanding the implications of when AI is used for nefarious purposes is concerning. When I was speaking with someone on our marketing and communications team, she brought up the fact that we don't use AI images, AI-generated images, because right now there is concern that the artists are not being paid for those images. And so there are some real ethical concerns with using some things that are AI-generated. You asked the question about where or, how do we educate? When does that begin? And I think, there are, middle schoolers who know about ChatGPT, right? And so I do believe that there has to be something put in place with the guardrails. And the conversation we were having earlier is, who owns that responsibility? Is it our education system? Is it our schools that put guardrails around use of those things and are talking about the ethical concerns? As an organization, and as a nonprofit organization, we have a responsibility, again, because we believe that AI can be additive. But to your point, having the domain experience or the subject matter expertise and all of those soft skills are more important to us. But understanding that we will get left behind as an organization if we don't sufficiently and proactively integrate AI into our business processes. So it's not just about the thinking, but it's also to stay competitive. We've got to be able to figure out how we have some part of our training that is dedicated to these AI tools, recognizing that they are tools. And so I think that's where we leave it.
I think part of the training too is going to be very much important to be based on scenarios. So I think if we can do scenario-based training and showing how AI works really well, and then because I constantly people are like, all you do is tell us what we can't do, what can we do? And so I think we should, here's a great positive use of AI. Here's where in a scenario it might not, or here's how it relates to your reality. I think the challenge is to teach people about AI is pointless. How does this work to help you do your job every day? That's what you care about. We'll show you how to fold that in. I think we can do it in scenarios with reality training, which I know is a whole other topic. That I think would be really valuable.
That's a very good point, and I think that you can train the people with case scenarios, or like also you have a simulation environment, and see, by the way, we discussed that before. Eric Topol reported that when you have AI humans expert and humans expert with AI perform better in terms of diagnosis than they are to others. I mean, the human expert and the human expert with AI, probably because the human expert didn't want to use or didn't know how to use AI properly. So that is really something that we have to understand better, because to teach the people, it was like a joke I said before. Should AI train us to AI? Yeah, they should. But they cannot train us to the interface between humans and AI tools. So I think it's something that we have to explore. We think in Montreal now we have moved from our School of Artificial Intelligence applied to healthcare, from the CHUM, from the healthcare organization, toward the university, to broaden the spectrum and to teach a little bit more. I just want to have a last question. We said until now, we will not be replaced. And in fact, this is true because we are in a shortage of human resources. But maybe now we can imagine that we will be replaced. And I am a cardiologist. If you say that to me a couple of years ago, I would say, no way, crazy. Not true anymore. I think we can be replaced. Okay, empathy, all that kind of things. So we say AI is not able to do that. But we have a lot of studies that show that, for instance, in the elderly with neurocognitive disorders, the robots with AI interact better with the person than the human beings. It was published in Japan, but we have other examples of the same thing. So do you think we can be replaced? You have 55 seconds to respond with just a word.
One thing here. Is it impossible to be replaced? No, it could happen. What I think is more likely, however, to happen is that our roles will evolve and new jobs will be created that are far more interdisciplinary. And that there will be always, and unless something very crazy happens, doomsday scenario-wise, that a human will be needed in every aspect, not just of healthcare. I'm also talking finance, I'm talking other domains, right? To actually, at the bare minimum, sense check and guide AI. So roles will change. I think we can all agree on that one, regardless of what happens. But are we all going to be 100% replaced? I wouldn't think so. And my last point is, to all of these studies, they need context. Who were the patient populations that were, evaluated and diagnosed? Who is typically represented in our healthcare system? And how were these algorithms, or would they perform in domain A compared to domain B, right? And that applies not just to population predictions, but also personalized medicine, right? And we're currently not at a point to utilize all of that data at once, have the algorithmic abilities to do so, and also have it explainable. And that's me done. I could talk more, but 1 second, I'm done.
I think our time is done, but I would love to have your 2 short answers.
As long as health equity serves as the core of the work that we do, no, and hell no.
I think, no, I agree. I don't think we'll be replaced. I do agree. I think we will evolve into new jobs that we can't even, as we know, we don't think of now. I think some jobs we'd be happy to have. I mean, if somebody wants to replace me, having to deal with a lot of digging through my email, have at it. I mean, there's a lot of jobs I'd be happy to have some replacement for. But I think it is evolution. I think it's evolution. We'll find new different ways to do things.
Well, please give a warm thank you to this amazing team, Fabrice,